mental aspect. An example of how we built this work together to increase wellness.
The impetus for this project came out of a broader ACPLF project that is based on the Alberta Healthy Communities approach. When I was asked to develop something that would involve Indigenous people, I quickly realized that that approach was going to have to be adapted quite remarkably.
The project is around cancer, and cancer is a really difficult topic for any culture. And then when you're in Indigenous communities, like talking about cancer is, a little more difficult.
Like, I've never believed that I empower anybody. I don't agree with that language. But one of the things that I do agree with is that I'm willing to put things in place for people to help them empower themselves, and I think that's what this opportunity, this way of doing things is providing. And the outcome of that is wellness.
As Indigenous people, all of our work is grounded in our relationships and the bridging of relationships. And we were already doing work with other Indigenous groups. So I went to some of my colleagues who I knew were from Métis Settlement communities, had strong relationships there. And it took us at 1 year at least to go several times and meet with those communities, propose this project. And in fact, it was 1 week to the deadline that we had to have an answer, and we wanted to work with the Métis Settlements. There was 3 of them, and it was less than a week before the deadline that they all signed on. That was phase 1. In phase 2, we realized that we needed to revise the tools that we had. We now had a proof of concept for this approach and this model. And we wanted to do implementation testing to gain the evidence that we would need to have our model and approach taken into operations. It's really important in building trust with Indigenous people that you go out and you meet them face to face. They want to see who you are as a person. They want to see how you react. They want to be able to be responsive to what it is that you're saying. That is very difficult to do in any other way except for meeting in person. You want to follow cultural practices like sharing meals, doing gifting, finding out what the practices and protocols of that community or that nation are.
That's one of the things that I heard a lot, is that we need to come together as community again. Things that used to happen, things that used to be important, and ways of creating that connection.
Communities have their solutions. They know what they need to do. They don't need us to tell them what it is that they need to do. They usually have their own strategies in place. It's about providing the right information and the right resourcing to help them do this work.
Using really interesting ways, like one community had a horse whisperer come and talk with the youth, and tied in tobacco use, and just like a lot of times they're talking about like honoring yourself and honoring your body. And how can we do that if we're not healthy? We're not putting in good food. We're not being physically active.
When we talk about healthy eating, we're talking about being able to live naturally with the land, right? And we know how to do that. We still have some folks that know how to do that. So it's about helping them and providing the funding, the opportunity for them to be able to utilize their skills.
There's one community that even looked at baby foods and talked about like how much salt is in there and sugar, and then showed them how to make your own baby food. And the collective kitchens introduced different vegetables and fruits that people, may not have tried before, and had recipes, and the facilitators talked about like how would you use it. That's a big part of healthy eating, is affordability and access, and a lot of them focused on that. And so then you're kind of focusing on those areas, but also showing that by doing this you're reducing your risk of cancer and other chronic diseases.
By having a garden, by knowing how to plant the seeds and grow the garden and do, the canning and drying the meat and all of these things, these are about us sustaining ourselves. And really the approach is looking at how can we sustain this. When you go hunting, you're being physical. You set your traps, you walk for miles behind a moose. There's all these pieces that fit within the framework of these risk factors that are identified by the Western world, but they're all things that we used to do. It's all the folks on the ground. Let's honor the work that they did, because they worked so hard. And seriously, amazing work. I mean, yes, we're coming from a research perspective, but it's also the work that the people are doing on the ground through all kinds of adversity, right? We're talking about floods and fires and COVID and all the things that would knock a lot of people down, just make our people stronger. And as a Métis person, I feel very happy and honored to be able to work alongside our people and recognize and honor their way of being, so that they can really share who they are by the work that they do.
I guess we have good leaders. The people that organize it know they done their homework before they threw it out at us. They didn't just throw it at us and say, you're on your own. They, step by step, and that was a good thing. They were very helpful. And, I've been into a lot of committees and that, and this is the one that it touched the heart, because the program is about the heart. And they were right there. They didn't leave you, give you a bunch of information and then just say you're on your own. That's not the way I seen it. I was very happy to be at a meeting, because I know I learned something about cancer, how, where we could go, what we could do. So I'm very happy of all the times that I've attended a meeting, because there was always something new that I should know.